Hello, everyone, and happy Thursday. Thanks for joining us tonight. My name is Ryan Googe, and I am the Executive Director of the Partnership to Advance Cardiovascular Health, which we call PATCH for short. I want to thank Amgen for sponsoring tonight's webinar. PATCH is a coalition of a number of doctor, nurse, and patient organizations that work for better healthcare for people living with heart disease. You can see on the slide here the many organizations that we collaborate with. PATCH's mission is about people. We want to make sure that anyone who has had a heart attack or stroke, or anyone who is at risk for having a heart attack or stroke, can get the care they need to live long, productive lives. In the course of our work, we are so fortunate to meet and work with amazing doctors, nurses, and people living with heart disease. And these clinicians and patients are gracious enough to take time from their busy schedules to advocate for people who are on their own personal heart journeys. And that's what tonight is about. COVID-19 is unfortunately still a serious reality. Our lives continue to be disrupted, and we still have distance from family and friends, and even healthcare is also difficult to obtain at the moment. So we're hoping tonight to have a conversation with you, a heart-to-heart, about your most important organ, your heart. Are you or a family member at risk for or have experienced a heart attack or stroke? Is cardiovascular disease preventable? And what are the best practices for keeping your heart healthy? We'll answer some of these questions and some of your own questions as well throughout the hour. Tonight, we'll have two conversations and opportunities for questions. Our first conversation will be with Dr. Jan McAlister. Dr. McAlister is a board-certified adult nurse practitioner, a clinical lipid specialist, and a member of the Preventive Cardiovascular Nurses Association. Joining Dr. McAlister will be two fellow Georgians living with heart disease, Barbara Fleeman and David Devine. Today, Barbara and David are active patient advocates who raise awareness of heart disease with Women Heart and Mended Hearts, two of our partners. Everyone watching us live this evening should please feel free to ask questions in the Q&A box, which you'll find just below the live feed. We will do our best to incorporate the questions in our discussions. So with that, I'd like to welcome Dr. McAlister to the feed. Dr. McAlister, so glad to have you join us. As you know, PATCH organized this webinar as a source of information for people with or at risk of heart disease. And we want to make sure that people leave this webinar having a strong understanding of cardiovascular disease, its risk factors, and how it should be managed. So what I want to do actually is start with the basics. We call them, the 101 questions. So the first one I'll ask, we'll get as basic as we can get here, is what is heart disease and what causes it?
Well, Ryan, first of all, I want to thank you guys for having me here. I appreciate the Partnership to Advance Cardiovascular Health for asking me to participate in this webinar. And yes, it's very important to know the basics and understand the basics. It is interesting because what is heart disease? So actually, there are several definitions of heart disease. One, you can have valvular heart disease, which is where there's a problem with your valves and you may have more congestive heart failure. There is also electrical heart disease, where you have electrical disturbances like atrial fibrillation that cause other risks. But for our conversation tonight, heart disease is really blockages in the arteries that are preventing blood flow of to the actual heart muscle. And if you reduce blood flow to the heart muscle, you have a heart attack. And those blockages can be very soft blockages, which are at risk of almost popping open or exploding, and they cause this cholesterol rich core to open up into the vascular system of the heart, which immediately causes a blood clot and can block off blood flow to the heart muscle. And that is your heart attack. Or it could be a more calcified blockage that may be 75%, 80%, 85, 90% that you see on a heart catheterization, that we can go in there and we can put a stent in and open it up and allow for more blood flow. And those usually do cause symptoms. And I'm sure one of your next questions is going to be, what are these symptoms of heart disease?
Yeah, I think that when folks normally think of heart disease or anything heart related, they think of the bad stuff, right? They think of heart attack, stroke. That's what people think of when they think of anything related to kind of
I
heart
can't
disease.
hear you.
Oh,
I'm sorry, I didn't hear you. You dropped out there
oh,
for a minute. What was the
I
question?
was just saying that I think when people think of heart disease or anything related to heart disease, they think of like the really bad stuff, heart attack, stroke, and unfortunately, a lot of us know or have had a heart attack or stroke at some point. But can you tell what are the telltale signs before that? Like, how can we tell that we might have some sort of issue going on with our heart, or what are the we call them in the medical world, we call them risk factors. What are the risk factors of the telltale signs for heart disease?
Well, it's interesting. There are a lot of patients that have no symptoms whatsoever, or very mild symptoms that come in and see us, but they do have multiple risk factors. So the key is starting early and getting screened for your risk factors. So, one risk factor that we don't have any control over is age. As we age, heart disease becomes more prevalent. Another risk factor that we can't control is genetics. So, if you have a family member that had an early heart attack, stroke, stent, angina, and they were in their 40s, 50s, for women, even into their 60s, then that should be a red flag to you that, maybe along with getting your colonoscopy at age 50, in your 40s and 50s, you need to see a professional to define what your risk factors are. Now, your more modifiable risk factors are smoking. Smoking is one of the worst things that you can do for heart disease, because when you smoke, that smoking causes vasoconstriction. If there is any blockage in there, that's going to decrease blood flow to your heart. Blood pressure, predominantly blood pressure is genetic in individuals. There are some other episodes where it is not genetically related. But if you have parents, siblings that have a history of high blood pressure, then knowing what your baseline blood pressure is and getting it checked regularly is something that you need to do in order to define your risk factors for heart disease. High cholesterol is a big risk factor for heart disease. Certainly by age 20, everyone ought to know what a baseline cholesterol level is in their bloodstream. The higher the cholesterol, we know the more likely you are going to form plaque in your arteries. And being able to lower that cholesterol through diet, exercise, and possibly medication is an imperative means of really reducing that risk. Now, we know that for premenopausal women, We have naturally producing estrogen, which is actually somewhat protective for us. But all women after menopause should go to a women's screening program and be evaluated for all of their risk factors, because as we go through menopause and we lose that estrogen, we no longer have that cardiac protectiveness, and it cannot be redefined through taking your oral estrogen therapies.
So, Dr. McAlister, can I ask you? I was, you were talking. You said in your 20s you should know your kind of baseline cholesterol. So that brought up a question in my mind: is how early should we really be thinking about that? Is it in your 20s? You think?
Well, first of all, I think you need to know your family history. And so it's really important to talk. Our ancestors had a history of not really talking about their health and their health issues. So I think it's an important conversation to have if you could get everyone at the dinner table and find out what the health history is of the family. And I think everyone, certainly in their 20s, ought to know just baseline where they stand, blood pressure wise, cholesterol wise, obesity wise, and get a nice baseline. Now, we do have familial hyperlipidemia, which is a genetically high cholesterol with these very high LDL numbers. For individuals that have familial hyperlipidemia, they're at an even greater risk. And so, those individuals that have FH in their family, we start checking in the pediatric ages to evaluate which of the children and the offspring are carrying those traits, so we can start treating them early to avoid the early coronary ramifications.
So you actually touched on this a little bit there. I'm curious about how heart disease impacts men and women differently. We're actually later on in the program, we're going to be talking to a couple of patients, one male, one female. So I'm curious, what are the kind of the general differences that we see, and does heart disease in fact impact men and women differently?
So it would be great if that we could put everything in a little box and it stayed in that box and we knew all of that. It does vary from person to person. Generally speaking, your males do have the typical elephant sitting on the chest. When you exert yourself, when you exercise, when you go upstairs, it has a tendency to go away with rest. It may extend into the jawline. And usually it's kind of a heaviness that may come down the left arm. But it does usually come on exertion and goes away when you sit down and rest. It's not those 1 second, 2 second little sprouts of pain that you have, but it's there for, certainly 20 or 30 minutes, usually. For women, it's a little bit different. They may have that elephant sitting on the chest, but a lot of times they have discomfort in between their shoulder blades. A lot of times they have more dyspnea on exertion or shortness of breath when they're going upstairs. One of the big complaints from the females is that they have a change in their stamina. So when I'm talking to them, they'll say, I used to be able to go up 3 flights of stairs carrying laundry. Now I can only do one. I used to be able to go up, the stairs at the mall when I'm shopping. Now I have to take the elevator or the escalator. So a change in stamina is certainly a big red flag. But one of the problems with women, women show up later to their provider to get it diagnosed because hubby comes first, kids comes first, work comes first. So women have a tendency to put off seeing their provider. So often when women do finally show up, it's later in the game and their disease is much more serious, because we also have to remember women have smaller arteries than their male counterparts. So if you have a blockage in a smaller artery, that is certainly going to induce more symptoms than in a larger artery.
Interesting. So, you think about cardiovascular disease and diabetes and obesity and all the conversation that happens around that in America today. And what naturally is part of that conversation is diet. And what is a good diet? What's a heart healthy diet? And there's all kinds of diets out there. You've got keto and vegan, Mediterranean, vegetarian, all these things that exist. So I'm curious, what's your take on what the best diet might be for someone at risk for heart disease or someone that's experienced a heart attack?
So, well, if we had one diet that fit all, it would be great. But if you Google diets, definitely you're going to get a plethora of information. It is interesting because dietary support is probably where we lack the most controlled trials as far as cardiovascular outcomes. We know the DASH diet is great at helping with the high blood pressure readings. We have diabetic diets for diabetes for those individuals who have higher blood sugars, managing the sugars and the relationship of carbs and proteins together, which is very important for the diabetic. The Mediterranean diet is probably one of the most studied diets out there, which seems to be one of the best for your cardiac patients. It's high in vegetables, some fruit, but it's mono and poly unsaturated fats, low in saturated fats. For your kidney patients, you have to be on a kidney safe diet, watching phosphorus, watching your potassium. And then there is the keto diet, which is a big phase right now. I personally have had a lot of patients where their cholesterol has gone up on the keto diet. But where some of the benefits come from is patients do lose weight on it. So I think the proper diet is provider and patient specific, depending on what it is you're exactly trying to treat. And predominantly in our clinic, we utilize the Mediterranean diet for our cardiovascular patients.
Oh, interesting. So there's no one size fits all, but it seems like the Mediterranean diet, though, for just in general, you recommend that. That's interesting. Okay. Well, I want to touch base on we have some folks I'm sure that are on the stream that have experienced a heart attack or a stroke in there at some point. Can you walk us through what those people should be doing to prevent another heart attack after they've had one, or a heart event of some sort, a heart attack or stroke? Or
So the big thing is managing risk factors. So certainly, after a heart attack or a stroke, you usually get on blood thinners. And one of my biggest suggestions is once a provider puts you on a medication, don't stop it without talking to the provider. Because there are serious ramifications if you just had a heart attack and they put a stent in your artery. You're supposed to be on a blood thinner for at least a year. And if you stop that blood thinner, it puts you at risk of restenosing that stent. And so, certainly, you need to make sure you are following all of your provider's recommendations. And the next step in prevention is obtaining goals of all of your risk factors. So, if you're a diabetic, we want your hemoglobin A1C at least less than 7, preferably less than 6.5. If you have high cholesterol, one thing they're going to put you on is a statin medication. And I know I hear from everybody hates statins. But statins do lower cholesterol. They do prevent progression of disease. We have 30 years worth of randomized controlled reproducible trials benefiting heart patients by placing them on statin medications. Um, our target LDL for patients with stroke or heart attack is an LDL less than 70. Now, some of the guidelines are driving that even lower to 55. So we want to make sure we obtain those goals in our high risk population. We want to eat a healthy diet. The Mediterranean diet, low tons of vegetables, lean proteins. If you eat proteins, watching your processed foods. You want to exercise. I usually recommend at least 30 minutes, 4 to 5 times a week, and steadily progressing from there with weight training a couple of times a week. Certainly, if you're smoking, we try to get you to quit smoking and put you on some means to assist you in smoking cessation. So utilizing all of the tools that we have in our toolbox to try and relatively lower the risk of a recurrent event by treating all those risk factors that increase it.
And Dr. McAlister, can you kind of put a fine point on it for us? If you've had a heart event of some sort, what's your risk? How high is your risk for another event? And what I'm really trying to get at is helping folks understand how important it is that they follow their medicine regimen, that they follow their diet plan that their doctors recommended, they follow an exercise plan. So what's your risk afterwards? And like how what's the timeline normally for people? Is it within 6 months, within a year? What are we looking at?
So your patients who have had a heart event, their risk of having a recurrent heart attack or a stent or bypass surgery is much higher the first year after their index event. So you come into the emergency room, you're having a heart attack, they take you to the cath lab, they put a stent in you. That first year after that event, your risk is much higher of having a recurrent cardiovascular event than if your heart attack was 3 years ago or 2 years ago. So it's really key that very first year after the event to get aggressive with care, both for patients and for providers, driving that LDL down to at least a minimum less than 70 based on guidelines, getting the hemoglobin A1C down, the blood pressure down, the stop smoking. But your risk is much higher that very first year.
Got it. That's very helpful. Thank you. So one question that we've heard in these forums before is, and I wanted to ask you because I think it's an interesting one and an important one, is can I manage my heart disease without medication? Is that possible?
Well, we do not have data that without medication, you're going to reduce outcomes. So it depends on what your goal is. If your goal is to be off medication because it's not natural, it is synthetic, and I pulled it up on Google And all the research on Google, which is not research, says it's bad, 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 then you're leaving yourself open to recurrent events. Certainly, if you're not going to take the blood thinner for the first year, you have a very high risk of restenosing the stent that they place there. If you're not going to be on the statin, statins have been around a long time, but they really get a bad rap because statins have this pleiotropic effect that we in science have yet to explain, but they decrease inflammation. And inflammation is a part of heart disease. So the more inflammation you have, especially if you have an inflammatory process like lupus, rheumatoid arthritis, you already have a high level of systemic inflammation, and these statins have decreased inflammation in the lining of the arteries that can prevent progression of disease, can help prevent strokes, prevent heart attacks, prevent more stents from occurring. So really going on the medications is more about preventing you from coming into the hospital than it is to just put you on something because the provider told you to put you on it.
I want to follow up to that. And you mentioned this, a lot of people get information from the internet for their for medical reasons. So I'm on their healthcare. Are there any websites that you do that that not necessarily recommend, but how do you kind of counsel patients when they're coming to you with information they're getting from the internet?
So, one, I counsel them on talking to their provider because ultimately it needs to be a provider patient relationship. And now we've opened it up to where it's so much easier for patients to talk to their provider through electronic medical records. You have the EMR systems. Everybody has portals now that it's so easy to send a message and say, I want to have a conversation about blank. Because when, and this, happened to me today, I had a patient tell me, well, I had a side effect from this medication is raising my blood pressure. And I said, well, you started on this medication just 3 months ago, but you've been diagnosed with high blood pressure since 2012. So tell me, how is it that this medication is causing your high blood pressure? Because high blood pressure is a progressive disease. So we had to have a conversation, but he's looking at a two-dimensional verbiage on Google that is not really complete. And so I don't really recommend any sites. I just encourage my patients, if you see something, send me the article, send me the link, talk to me, let's have a discussion, and let's go over the risk and the benefits and discuss where your questions are.
Thank you. That's fantastic. So I want to pivot real quickly to something that is now, again, unfortunately, at the top of the news, and that's COVID. So we're now at a stage in the pandemic where vaccines are accessible to everyone. As we know, individuals with underlying conditions are identified as the most vulnerable population, diabetes and cardiovascular disease in particular. For those folks living with heart disease and diabetes who have been vaccinated, should they still be taking precautions at this point? Or actually, let me clarify that question. Are you recommending patients go to healthcare settings now if they're vaccinated and all those they're vaccinated and protected at this point?
So we still see patients in person, plus we do virtual. I still encourage everyone to wear their mask, certainly in an inside setting. N95 mask is excellent. Currently, Georgia, Atlanta's been hit hard. We've had the National Guard issued to some of our hospitals because there's not enough space for patients. We're turning our cafeteria into a place to put beds to help triage patients. I can't get a heart cath on one of my patients who needs it because all of the elective procedures have been canceled. Another thing with COVID, I find that patients are getting very lax at taking their medications. They don't go to the pharmacy to get refills. They may run out of a medication and they don't contact their provider and let them know that they need a refill, or they may need a prior authorization and no one ever contacts the provider to let them know. Or they don't come to the office and they don't talk to the office and they don't get refills on their prescriptions, so they just quit taking them. And then on the diet front, everyone has decided, or not everyone, but it's very common that people come in gaining 15 and 20 pounds because they need this comfort and they're eating because they're at their house all the time. And they are eating, fried foods. They're getting takeout with tons of salt, saturated fat, tons of sugar. And so I just encourage everybody, yes, to wear their masks. I encourage you that if you're high risk, diabetic, have heart disease, you have risk factors, to stay vigilant, stay safe, be proactive on your own behalf. Don't get caught up in the media minutia. But remember, vaccinations are there to help your other people, not necessarily to help you, because you can still get COVID if you're vaccinated. It just decreases the symptoms and it decreases hospitalizations, but it doesn't mean you're not going to get COVID. So certainly, it does, we know, help prevent other people from getting COVID. So the more people vaccinated, the faster we get to herd immunity, and we can help wipe out this dreaded COVID-19 virus that is out there.
Absolutely. And as a follow up, you're saying that folks there's been lapses in taking their medication, maybe some hesitancy to go to the doctor still, that kind of thing. Can you talk a little bit about your experience with telemedicine options? Maybe encourage folks to look at that as an option for them as well.
So I got to tell you, when the telemedicine option first came out, I was like, "Oh no, there's no way this isn't going to be something that allows us to give great care." But I'm a huge advocate now. I do it a lot, both video and telephone. Once you get past some of the IT barriers that patients have, it's a great touch point because you can reach anybody and everybody as long as they have internet access. So I've actually had several offices 2 hours away that I see patients virtually, and I'm able to grant them access to the medical care, the same care that we're giving in downtown Atlanta, that they didn't have access to in their little rural community. And it really opened my eyes that we can reach more people, give them better and effective care, and we work with providers that are closer to their residential area. And I do telemedicine, and as a team, we can deliver the patients the kind of care that they need for prevention and their treatment of heart disease.
That's great. So I think, for anyone on the line that's maybe hesitant to go to a checkup or is having trouble with a refill, you should know that these telemedicine options are still available. And I think that a lot of providers like yourself have gotten good at it. So it's definitely a great option at this point. Well, Dr. McAlister, we're having a little trouble with our widget for audience questions, and we're out of time anyways. We've used up all of our time, but For folks that are trying to submit questions, just be patient with us. We'll try to get that up. But Dr. McAlister, thank you so much for being with us. Incredibly informative. I know it's great to hear a true expert like yourself about these 101 questions and trying to figure out how to navigate life with heart disease, or if someone's at risk for heart disease. So thank you so much for joining us, and have a great rest of your evening.
Thank you, Ryan. Appreciate it.
Take care. So with that, I'm going to invite Jasmine Patel, my colleague, to come to the webinar, and she will do some interviews with some patients that are dealing with heart disease. Jasmine?
Thanks, Ryan. So I have David, Sally, and Barbara joining me today. I'm gonna wait until they're on the screen. Thank you so much for joining us. David and his wife, Sally, are volunteer advocates with Mended Hearts, and Barbara is a women heart champion. So David, Sally, and Barbara, it's important for folks to hear from people navigating through their heart disease journey. Dr. McAlister gave us a great overview, but as you all know, as advocates, there's a lot to learn from the lived experience. So I want to learn about you. Let's start by telling us where you're from in Georgia and what you do or did for a living. David and Sally, I'll start with you, and then Barbara, you go ahead. So David and Sally, tell us where you're from.
Sally and I live in Canton, Georgia, which is a small community north of Atlanta, about 45 minutes. And we moved here 20 years ago to watch our granddaughters grow up. And they have grown up, they're all in college, but we enjoy the area. I had a fantastic career. I really loved it. I'd still be working if my wife let me. I started out as a trainee in retailing, and I worked up to being a senior vice president of a elite department store. And one of the things I was very excited about was I spent 30 years traveling to the Orient, having clothing manufactured and having it shipped back to the United States. Consequently, I got to see a lot of the world, and I met a lot of nice people. So I'm happy.
Wonderful. Barbara.
Hi, Jasmine. Thank you for having me. I grew up here in Atlanta, and I'm retired now, but in my professional career, I was a consumer marketing and special events department in the entertainment industry.
Wonderful. Okay, so Barbara, I'm going to actually continue on with you. Give us an overview of your heart journey. What are you diagnosed with?
I have a little laundry list of things that I've been diagnosed with. I have ischemic, non-obstructive coronary artery disease. I have coronary microvascular disease. I have coronary artery spasms, and I have atrial fibrillation.
That is a laundry list. So I understand, you were not diagnosed with all of these things earlier on in life. And based on what you told me previously, your journey to diagnosis was quite a long process. So tell us about your experience with that.
My symptoms started showing up probably, I think it was 2013. And over the course of 2 years, I consistently was getting sicker and sicker. My symptoms were becoming more pronounced. And whenever I would go to the doctor and be tested, I was always told that there was nothing wrong with my heart, that my heart tests were perfectly normal. And it seemed that to me, it was always something else that was wrong. It was either, oh, you're anxious, or oh, it's acid reflux, or postnasal drip, one of them said, menopause, anything and everything except my heart. And I kept asking, well, then why does my heart hurt? And I kept getting the answer that it's not your heart. There's nothing wrong with your heart. So to make a long story short, I was living in Los Angeles at the time, and I was getting very frustrated with not finding an answer. So I did find the Cedars-Sinai Women's Heart Center and made an appointment to meet up with the medical director, who was Dr. Noelle Berry-Mers, and also with Dr. Pooja Mehta. And they were able to find what was wrong with me and diagnose me almost immediately. They knew exactly what was wrong with me, put me through the correct tests, and was able to come up with a diagnosis. And it's been uphill all from there, a couple of little, hiccups here and there, but for the most part, I've been very well taken care of and treated, and I'm very happy about that.
Yes, and my understanding is that ischemic non-obstructive coronary artery disease, that is a mouthful, INOCD, affects more women than men. So wonderful that you were able to get the right diagnosis. And to that point, you are, yes, absolutely. And you are your own advocate, which is, in my opinion, and I'm sure a lot of people can relate, the best advocate you can possibly have. And having to deal with all those misdiagnoses and that feeling of just someone isn't listening to you, I'm sure is frustrating. And I can imagine that as a women heart champion, you probably elevate these issues often. So do you come across similar stories from other heart patients you meet?
I do most definitely, because there was a time when I was going through my journey where you feel like it's only happening to you, and there's no one for you to talk to. What I've learned over my journey is that, first of all, heart disease is the #1 killer of women, period. Women are at a higher risk of being misdiagnosed or simply just dismissed because their symptoms of heart disease present differently than men do. And therefore, sometimes they just aren't treated because they're not believed.
Right.
The type of heart disease that I have, and that's very common in a lot of the women that I talk to, is it's called INOCA, the non-obstructive coronary artery disease. And the issue with that is that what that means is the tests that doctors normally automatically give you when you go in and say, my heart hurts, I have shortness of breath, I have pain in my chest, I'm fatigued, I don't feel good, I have pain. They will immediately do, an EKG, an echocardiogram, they'll test your blood pressure, they'll test your cholesterol. These are all very standardized tests that fundamentally will show heart disease, but it will only show heart disease in your major arteries. With non-obstructive coronary artery disease, my heart disease is not in my major arteries. It's in my microvascular system, which is a totally different area of my heart. And it doesn't show up. You have to know what you're looking for, and you have to know how to find it. And if you don't, then you don't get diagnosed. So that was a big part of what I was finding. And I hear from so many women that I talk to that it's just they don't have anyone to talk to explain to them what's going on and how to deal with it. And it's very frustrating. And because they don't know, it's very difficult for them to advocate very strongly on their behalf because there's no information. So it's kind of it's a difficult wheel to find yourself running on.
Mm-hmm. Thank you for sharing that. David, I'm going to pivot to you for a second. So when you and I spoke, you shared with me that you were competing in a race when you found out about your cardiovascular issues. So can you tell us about that day, please?
Yeah, it was July 4th. There's a very well-known race here in Atlanta. It's called the Peachtree, and it's run on July 4th, which is quite warm here in Atlanta. And I thought I was in good condition, and I was running, and there's a hill. It's called Cardiac Hill, and when I was going up Cardiac Hill, I was not feeling too good. And at the completion of the race, both of my sons were running in it, and they both said, "Dad, you're so white, you don't look good." And the next day, I had a stress test, and they found that I had 100% blockage of both my arteries. And I was not aware of that prior to the race, of course. And then I had to have stents put in my arteries. And my doctor, my cardiologist, told Sally that I could have died out there, because the only thing that saved me was, apparently, and I didn't know this, that your body develops blood vessels that support your heart, even though your arteries are completely uh, blocked. And they put in 3 stents, and it seemed to work. And it was an exciting day, but not as exciting as I would have liked.
Yeah. So, knowing that you were very fit and healthy, I'm sure this hit you out of left field.
Yes.
So were there any warning signs leading up to that day? Was there anything
No,
that you knew about
no,
yourself or your family
absolutely not.
history?
I,
Okay.
I've done, I think, a pretty good job of maintaining my weight. I work out 4 days with a personal trainer. We work on cardio. We work on balance. Um, I didn't do a lot of running, but enough running that I was in some kind of shape. And I was just overwhelmed when I found out that I had this problem and I had to have the stents. And then I became, of course, very concerned about, my heart.
And when you look back at your family, did heart disease run in any members of your family lines?
Yeah, very much so. And I guess I was aware, but I wasn't aware. Uh, my paternal side, my grandfather died at 48 with a heart attack. My father had a rheumatic heart. And on the maternal side, my grandfather died very early with a heart attack, and his son, or my uncle, also died of a heart attack. So there was a lot of history there, which I guess I was aware of, but I didn't take a, I didn't think about it as an issue. Should have, but I didn't.
Sure. Yeah. I mean, the topic of family history is very important to discuss, when you're thinking about your own heart health. And so, now that you know that you probably inherited heart disease from your family, I'm sure this is a topic of conversation with your sons, and I'm sure it will be so, in future generations. And David, you have your
Absolutely, yeah.
wife, Sally, sitting next to you. And I'm sure Sally has been your source of encouragement, your rock, and has played somewhat of a caregiver role. So, Sally, I'm going to ask you this question, and this is really for people who have a loved one living with heart disease. How do you help keep David on top of his health as his partner?
One thing, when you're aware that whatever your partner has a cardiovascular problem, you want to get involved. And I go to all of Dave's doctor appointments. I take notes and I ask questions. So I'm pretty much into to what is going on with him. The next thing is I encourage him to lead a good lifestyle. Um, I think that's about all you can do with an adult, not nag.
Mm-hmm.
There was a time he smoked, but nagging didn't help. So, just encourage him with what you do. We both try and keep very active physically and also socially, which we feel is very important. Um, and another thing is, I don't treat Dave as an invalid, even though he's had an awful lot of incidents. I figure, you know, he has a chronic condition, and I support it. But that's the main thing.
Thank you for sharing that. I'm so glad that you have each other to help each other. So David and Barbara, I want to get into the doctor relationships. Tell us about your relationship with your cardiologist. What is your approach with him or her? And more specifically, do you feel that you make decisions together when it comes to managing your heart health? So Barbara, I'll ask you first, and then David, you go ahead and respond after her.
Okay. I love my heart doc. I absolutely love her. I feel so lucky that from the very beginning, when I was first looking for someone to help me, and I was in Los Angeles, that I found Dr. Mehta. About a year and a half later, I moved back to Atlanta, and my biggest concern was I needed a cardiologist, and I didn't want to have to train another cardiologist. I was so beaten up from all of the doctors during this 2-year period of leading up to finding Dr. Mehta that I just was very scared about that. And the good news is that I found out that she had recently relocated to Atlanta as well, here at Emory, and was part of the Emory Women's Heart Center. So that I don't even know how to put into words the level of relief and safety and trust that I have in her, and was so glad that she was going to be here to take care of me. I couldn't ask for someone who was more kind and considerate and compassionate, and a true partner in my care. I mean, I trust my heart to Dr. Mehta. And what I love about her the most from the very, very beginning, first appointment, was that she's someone that will let me ask any question. Like you can't ask too many questions. I feel free to disagree with her if I don't agree with something as part of a treatment plan. She's very open to having those type of discussions with me. And I don't feel, I feel very positive about that. We always end up coming to, a consensus for my care, which is very important to me. And she always makes a point before I leave to make sure that I understand completely where I'm at with my heart disease, where we're at with the treatment, and where we want to go. So she's a partner. She's a leader, and she's a partner, and she's someone who truly cares about me, and that's all I need.
Yeah, it sounds like you guys are a partner in your health. I mean, that's wonderful, and that's the ideal situation. David, can you agree with what Barbara's saying when it comes to your relationship with your cardiologist?
Yes, when I had the stents put into my arteries, I didn't have a cardiologist. I was laying on a gurney waiting to go in and have the stents put in, and this doctor comes up and he says, "I'm going to put the stents in this, and this is how it works." I said, "You talk funny. You must be from Jersey." He said, "Yeah." And I said, "Well, I am too. We're both from Trenton." So that sort of broke the ice. But he has been very, very involved, of course. He also was one who said, "Dave, you need a pacemaker. Your heart is beating way too low, and you need to have a pacemaker," which I had put in at that time. And fortunately, in his group, there was a doctor who put in a pacemaker. And then this summer, I had a bad summer. I was bleeding internally quite a bit, to the point where I was getting iron injections because I was losing all this blood and weight, and it was terrible. And excuse me. And what they figured out was I was on blood thinners, warfarin, and it was I was on it for several years, and it was too thin, and I was just losing blood. And the Dr. Menino said, "You're a good candidate for a watchman." And I didn't know what a watchman was, and I soon learned about it. And he had set up the appointments, and he followed up with it. And he didn't do the surgery for the watchman, but uh, Dr. Patel, it was part of his group, did the watchman. And we have a very good man-to-man relationship, and he is very blunt, comes out, and he just tells you exactly what you probably don't want to hear, but he tells you exactly like it is. So I feel very, very comfortable with him.
That's wonderful to hear. Before I continue with my next set of questions, the audience Q&A is up. I apologize if any of you were trying to submit questions, but it looks like some of the questions that came in actually relate to my next question. So besides taking your medication regularly, what else do you both do to ensure you stay healthy physically and mentally? David, you go ahead and go first, and then Barbara, I'll continue with you.
Yeah, I'm very concerned about my body. I spend a lot of time working with a personal trainer. I try to avoid potato chips and French fries and fried food. I try to maintain a good diet, and my weight is a little bit more than it should be, but I feel pretty good about that. Also, there's a lot that takes place. I don't know if you say mentally, but it is. Sally and I, since we retired, we've done a lot together. We've taken, I think, almost 30 cruises, some of them as long as 2 months, and we enjoy traveling. We also enjoy going to shows, and I belong to. I volunteer a lot. I volunteer at the hospital. Became president of the auxiliary. I volunteer at Mended Hearts, and which is a fantastic organization. And I became president of that. We set it up at the hospital, and that's been very rewarding. I bring in doctors and people who are in the medical business to lecture the people that are there, and also we go into the rooms prior to them having heart work done and try to make the people feel comfortable that they're going to have it, and also try to encourage them to come back and join our meetings, because our meetings are very good, and it gives the each person a chance to talk and compare their situations with someone else. It's a fantastic organization. We have 21,000 people in it, and we're in 450 hospitals. So we really enjoy that. I enjoy that. And Sally also, who is a heart patient, has had, you have to be a heart patient to be a member of Mended
Right.
Hearts.
Right. So I'm hearing that you give back and you don't let your heart disease stop you from doing what you enjoy doing. That's great. Barbara, what about you?
For me, there was physical issues that affected me from the beginning, and there were mental issues. But for me, the biggest one was the emotional impact that I had from the first day that I started getting sick, and that emotional building block, or just huge block on me, went for the 2 years where I just kept getting sicker and was not able to find a diagnosis or a treatment, because if you don't have a correct diagnosis, you can't get treated. And I just wanted it to stop. So it was a very emotional impact, more so because when it's your heart, you feel like your body is just deserting you. And you can't do all the things that you define yourself as. I was a very active person. I couldn't do those things anymore. So what I had decided, once I found Dr. Pooja Mehta and Dr. Barry Mers, and was finally on a road to recovery and a plan and a diagnosis and everything, there were two things that I decided. Number one was I never wanted another woman to go through the heartbreak and the disasters that I had to go through for 2 years to get to a diagnosis to become healthy. I didn't want anybody else to have to do that. I wanted to do whatever I could to help make sure that wasn't going to happen to anybody else. And that's how I found Women Heart and became a Women Heart champion. Went up to the Mayo Clinic. I was trained for 5 days at the Women's Heart Institute Center at the Mayo Clinic, and then came back here to Atlanta and have been working in the community, helping women understand heart disease and what to look for and how to deal with it. For the physical part of it, because that's a huge part of living with heart disease. Probably the most important part of my physical journey was having cardiac rehab, and that was part of what we did immediately after the diagnosis. Now, I will tell you, I didn't want to do it. I did not want to do it. I didn't think it was any good for me. I wanted no part of it. But it was the most important part of my recovery that I can tell you. I don't know where I would be if I hadn't done cardiac rehab. And because of that, I now continue to understand and to do the physical work that you need to do to stay healthy. I walk with my friends when the weather's nice. A couple of my friends and I'll go out to walk. Otherwise, I have a treadmill in my office room, which I do not hang clothes on. I walk on that at least. It's true. 30 minutes a day. If I'm not out walking with my friends outside in the fresh air, I will do 30 minutes on my treadmill.
Well, thank you for that. I can continue asking you both so many more questions, but unfortunately we're out of time. So I just want to thank you, Barbara, and both of you, David and Sally, and Dr. McAlister, again for volunteering your time and knowledge. We really, really appreciate it. And we hope to continue staying in touch, and hopefully we work together again in the future.
Thank you.
And I also want to thank Women Heart and Mended Hearts for connecting us to both of you. So as Ryan said earlier this evening, Patch is a coalition. If you are interested in joining our mission to improve policies that promote access to patient-centered cardiovascular care, we invite you to join us. We are always looking for patient and clinician advocates to partner with. On this image is our contact information. Thank you so much for giving us an hour of your time. Take care, everyone.